I usually cringe when I hear the term arthritis thrown around as it relates to sporting dogs. So often it will be from well-intentioned folks and it will go something like, he's getting stoved up from the arthritis in the back end, or we retired old Red at 7 because of shoulder arthritis. When asked how it was diagnosed, almost always the answer is, well, because he's limping, or the vet gave some arthritis meds. It's gotten to a point that now I'm actually shocked when people say, based on an exam and x-rays. Here's a newsflash. Not every dog gets arthritis. To further that point, not every limping, lame, or old dog with mobility issues has arthritis. I will confess that this is something that has also been perpetuated by the veterinary profession. In school, from a mobility standpoint, we were essentially taught that these dogs are bones and joints. And if they had issues, it was probably related to one of those two things. And if not surgical, then an anti-inflammatory was likely the answer. Over the course of my career, I have taken over the clientele of a retiring vet 4 different times. 2 of those with clinics I purchased. As part of those purchases, we would do a free exam for existing clients that needed drug refills, as it was necessary to have a valid veterinary client-patient relationship in order to prescribe meds. I was blown away at the number of people that would get downright angry when I suggest we not refill the anti-inflammatory based on exam findings and based on their own report that they didn't know if it was working. I was flabbergasted by the number of people that accused me of trying to pull a fast one on them, even though the exam was free and I was asking them to no longer spend money each month on drugs that weren't helping their dogs. They were certain I had ulterior motives, and it literally took an entire conversation to talk them off the ledge and for them to understand I wasn't making any money, nor had any plan to make money from that conversation. They had been giving the drugs for so long that they assumed it was a necessary part of their dog's life, and by God, they weren't quitting. This isn't to say that I never have dogs on long-term meds, but I do believe that the vast majority of dogs that are on them don't need to be. The reason for this disconnect is that for so long, we've assumed that if a dog was limping, it was a joint problem. Let's take a look at why this is so wrong. If I held this up, you'd quickly recognize that it was an animal pelvis, but you wouldn't know what type for sure. Same if I was to hold these up. Some of you would maybe get that it's an elbow and a shoulder, but maybe not. Now, if we take a look at a real life dog, you certainly would know that this was the rear end of a dog and that this was the elbow and this was the shoulder. The reason you are able to do that is because a lot of the other tissues that make this dog up are not bones and joints. In fact, in a dog, roughly only 12 to 13% of the body mass is bone versus 45 to 60% of it is muscle. Seems pretty foolish that we focus so much on such a relatively small percentage of the potential problem. Now, I'm not doing this video to say that arthritis doesn't exist or can't be devastating. It does, and it can. What I'm saying is that there are a lot of muscle, nerves, skin, and fascia that can also cause issues and discomfort, and for the most part has been ignored by the veterinary profession. In a well-bred hunting dog, out of lines that have been routinely health tested, outside of cruciate ligament tears, there are a lot of issues that can occur that don't involve the joints. Here's the other part that frustrates a lot of people. When these other tissues are involved, the fix usually involves owner involvement, a cooperative dog, and time. If a bone breaks, it's going to heal in 8 weeks. Typically, if we do a TPLO to correct a cruciate ligament tear, and most times we can have that dog back in the field around 12 weeks. When the soft tissues are involved, they don't follow the same defined timeline, and it's very frustrating to most people. I recently completed my first half marathon after a 12-year layoff from running due to soft tissue issues that I thought were unfixable. Once I got in the right hands, they were manageable. Note, I didn't say cured. I'm back to running. The crazy part is that for a lot of those issues, it wasn't necessarily an inaccurate diagnosis. It was the approach and treatment didn't align with my goals. I was completely functional, my wife may disagree, in most areas of my life. And so by most medical standards, I was fine. It wasn't until I got into the hands of a performance-minded physical therapist that we started attacking the problems from the perspective of a return to performance. Do I now need to spend an hour most nights using a lacrosse ball on my feet, a foam roller on my back, and doing maintenance exercises and stretches that I neglected through my 20s and 30s? Yes. But is it so worth it to me to spend that time in the evenings to allow me back out running? Also yes. With our dogs, there are options for keeping them in the field, but it requires a time investment from dedicated owners. And it isn't just a matter of popping a pill or using some whiz-bang new piece of veterinary equipment. I get it that isn't in the cards for a lot of people for a lot of reasons. I'm not here to judge decisions anyone's making. My role is to determine the problems and offer options for a given problem. In too many cases, I don't feel all of those options are always discussed. There are a couple of key items to understand to determine if you are going down the path of fixing a problem versus speculating at a problem versus just throwing drugs at one. First and foremost is getting an accurate diagnosis. This is going to be a combination of your dog's symptoms, your vet's exam findings, and any confirmatory diagnostics like x-rays. Honestly, in very few cases can you have just 2 of these 3 and still have an accurate diagnosis. I have had dogs come in with classic ACL symptoms, non-weight bearing in a rear leg, pain, and even drawer movement on the exam in the joint, only to take that x-ray and find cancer. Until we complete the diagnostic process, we are just making a guess. Once you have a diagnosis, it is important to understand your options for treatment. This may range from surgery to drugs to rehabilitation therapy and any combination or range of options in between. Where I would caution you here would be if you are offered extremes without discussion. What I mean would be responses like, there's nothing we can do, or you have to do this one surgery, or here are some drugs. Rarely is the answer that there is nothing we can do, though in the case of some cancers, this may be the case. Likewise with surgeries, there are often options and a discussion to be had about those options. On the drug front, there will always be drug options, but we need to know why we are using them and what our end goal is. You want to find a veterinarian that is a partner in addressing your dog's issues and will help get your dog back out to an active lifestyle. The important thing to understand is what your goal is with these treatments. Are we masking symptoms, treating a problem, or managing it? Over the next several videos, we will take a look at the joints we most commonly see issues with our hunting dogs and do videos on the hips, knees, elbows, shoulders, and the spine.